Identify the marked area of the bone. Name the structure attached to it. The marked area is lesser tubercle of humerus and subscapularis muscle is inserted onto it. Identify the marked area of the bone. Name the structures attached to it. The marked area of the bone is greater tubercle. 3 muscles are attached, that is supraspinatus, infraspinatus and teres minor. Identify the marked area of the bone. Name the structure attached to it. The marked area is the deltoid tuberosity of humerus. The deltoid muscle is inserted onto it. Identify the marked area of the bone. Name the bone articulated to it. The marked area is the capitulum and the head of the humerus is articulated to it, forming humero-radial joint. Identify the marked area of the bone. Which bone is articulated to it? The marked area is the trochlea of humerus. The trochlear notch of ulna is articulated to it, forming humero-ulnar joint. Identify the marked area of the bone. Name the structures attached to it. The marked area is the radial tuberosity. Tendon of biceps brachii is inserted onto the posterior aspect of radial tuberosity. Identify the marked area of the bone. Name the joint formed here. The marked area is ulnar notch of radius. Head of the ulna is articulated here and forms the inferior radioulnar joint. Identify the marked area of the bone. Name the structure attached to it. The marked area is the ulnar tuberosity. Brachialis muscle is inserted onto it. Identify the marked area of the bone. Name the muscle attached to it. The marked area is lower lipospinoscapula. The deltoid muscle takes origin from here. Identify the marked part of the bone. Name the structures attached to it. The marked part is the coracoid and shorter of biceps and coracobrachialis muscle takes origin from here. Name the structures attached to the marked area of the bone. Give its nerve supply. The marked area is the ventral aspect of the medial border of scapula. Serratus anterior muscle is inserted onto it and it is supplied by long thoracic nerve. Injury to this long thoracic nerve leads to wing of scapula. Identify the marked area of the bone. Which bone is articulated to it? The marked area is glenoid cavity of scapula. Head of the humerus is articulated to it, forming shoulder joint, which is ball and socket variety of synovial joint. Identify the marked part of the bone. Name the structure attached to it. The marked part is intertrochanteric line of iliofemoral ligament is attached over it. Identify the marked area of the bone. What structure is attached onto it? The marked area is lesser trochanter of femur, iliopsoas tendon. Tendon of iliacus and psoas major muscle is attached onto it. Identify the marked area of the bone. Name any 2 structures attached to it. The marked part of the bone is the linea aspera, which is a posterior border of shaft of femur, and the structures attached to it are origin of vastus medialis, vastus lateralis and short of biceps femoris muscle, insertion of adductor brevis, adductor longus and adductor magnus muscles. Identify the marked part of the bone. What structure is attached to it? The marked part is the fovea capitis on the head of the femur, ligamentum teres or ligament of head of femur is attached to it. Identify the marked area of the bone. Name the structure attached to it. The marked area is tibial tuberosity and ligamentum patelli is attached to the lower half of the tibial tuberosity. Identify the marked area of the bone. Name the structures related. The marked area is ala of sacrum. 4 structures are related to it. From lateral to medial side, they are obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic chain. Identify the marked area of the bone. Name the structure attached to it. The marked area is the pubic tubercle. Medial end of inguinal ligament is attached to it. Remember one more thing, in case of males, this pubic tubercle is crossed by spermatic cord. Identify the marked area of the bone. Name the structures attached to it. The marked area is anterior superior iliac spine. Sartorius muscle takes origin from here.